Hi, and welcome to this interprofessional team report presentation about the global environmental issue of recycling ULABs. This is Raed Kadi, a second-year MPH student at the School of Global Public Health in New York University. This presentation is a part of the Global Environmental Health course instructed by Professor Jack Caravanos in 2021. Lead is a toxic metal that can cause broad environmental pollution and health issues. Recycling of used lead acid batteries has rapidly grown with the increase in vehicle production industry. Informal and unsafe ULAB recycling could result in a serious health risks from lead intoxication through inhalation and ingestion of lead-contaminated soil and dust. National and international efforts, including technical and financial support, are needed to address this global public health problem. The selected interprofessional team suggestions will be contributed into a single plan of action. In this presentation, I will first give a short introduction about ULABs recycling. Then I will explore shortly the health risk associated with its informal process. Next, I will go through the professional interviews where I will discuss the interview guidelines, give a short summary of each interview, and conclude with an assessment of the various approaches. Lastly, I will overview the report summary. Now, let's talk about the ULABs recycling and the associated health hazards. ULABs recycling could be done safely and efficiently using batteries that are mostly found in cars, trucks, and other vehicles. Informal lead recycling simply the improper lead recycling process that is conducted in the absence of the appropriate measure and safety method and is considered as a source of lead exposure. Contamination can occur in the community from the following sources: mining and battery recycling, lead-based paint and pigments, lead gasoline, which is not as common but still exists in some areas, food can lead solder, lead in spices, cosmetics, medications, toys, and other consumer products. This is a global map showing clearly the global effect on this issue on children. Between 2007 and 2008, 80 children died from a disease of the central nervous system in the suburbs of Dakar, Senegal. Investigations found that 81 individuals in the community had high blood lead levels, including the children. The blood levels of 50 children range from 39.8 to 613.9 micrograms per deciliters. And for a comparison, levels should not be above 5 micrograms per deciliters for a child. The associated health impacts of the high lead dose are different according to the exposure onset. The high dose of the acute exposure can cause anorexia, nausea, vomiting, and other gastrointestinal issues. The chronic exposure, on the other hand, can cause inhibition of vitamin D and iron metabolism, anemia, encephalopathy, which is a disease that essentially destroys the brain, and other neurological disorders. Now let's explore the different professional opinions. First, let's review the guidelines. The previously described issue was discussed with 3 non-health professionals to explore their opinion. The interviews were focused on the suggested resolutions and how to reduce lead poisoning from informal ULAB recycling. The suggested resolution should follow the following guidelines. ULABs activities are a source of income for struggling families in low-income countries. So, banning of the informal ULABs may not be the best options because it can be the only means of living for the family. Each person should have creative suggestions with different angle approach. Now, let's explore the summary of the professional interviews. Let's start with Ms. Susan. Ms. Susan is a civil engineer in a huge construction company in New Jersey. She said that recycling of lead acid batteries is possible under certain circumstances with strict regulations. She thinks that most of the contamination comes from the lack of pollution control in the ULABs recycling areas. She suggested that to have environmental and air quality regulations that should result in less worker inlets, which will compensate the high implementation cost. Therefore, she is focusing on the implementation of personal protective equipment use and improving work practices. The next interview was with Mr. Paul. Mr. Paul is a banker in one of the famous banks in New Jersey. He said that ULAB waste management standards should be set in place. He also said that the safe environment requires effective pollution control. So his resolution for this issue was by establishing a governmental implementation of professional workers training, as well as creating an international standards for ULAB electrical recycling and transportation. Therefore, he is focusing on regional and global action to control contamination levels. The last interview was with Ms. Vivian. Ms. Vivian is a kindergarten school teacher in New Jersey. She said that children are the most affected, so efforts should be made to prevent contamination in those communities. She suggested that the recognition of the affected sites as battery recycling location, lead contaminated spots, and landfills is the first step that should be taken, followed by identifying homes and children playing sites around these areas. Once they are identified, health workers should be sent to those areas to educate the community on prevention methods. Therefore, she is focusing on education efforts by health workers to decrease exposure through increasing people awareness. Now we will assess the lessons learned from each of the approaches. Ms. Susan focused on implementation of personal protective equipment use and improving work practice, which was the civil engineer's approach. The banker's approach came from Mr. Paul, who focused on regional and global action to control contamination levels. Finally, Ms. Vivian holds the teacher approach, which focused on education efforts to decrease exposure through increasing people awareness. The professional approaches aimed for a plan of action that includes safety protection, national and international regulatory actions, and people education. In summary, children of low-income countries are the most affected population of lead poisoning. The unsafe setting of lead-acid batteries recycling are the main causes of this safety problem that need to be solved. The approaches reveals that there must be a utilization of different efforts that will ultimately allow for the reduction of lead poisoning. These efforts should include education by the health workers, regional and global actions to increase safety, workers training, and control exposure. This is the end of our presentation. I hope that you enjoyed. Thank you for your kind attention. And here are the references if you are interested in learning more about this topic. Thank you for your time.